are in listen-only mode.
Good morning and happy Wednesday. Apologize for the delay. We had a few audio issues, but I think we're in great shape now. This is Michelle Smith. I'm the state coordinator for Action for Healthy Kids, and we're excited to be bringing you information from the Texas Department of Agriculture, the Texas Education Agency, and Department of State Health Services to help you with your coordinated school health programs at your district and school campus level. So I'm excited to introduce our first presenter today, which is Jackie Cantu with the Texas Department of Agriculture, and she will be sharing updated information on what's going on with their agency. So, Jackie?
Good morning, everybody. Can you hear me okay?
Yes.
And thank you for joining us. I think I'll go ahead and jump right in. I just have some brief updates today for some major projects that the Texas Department of Agriculture, Food and Nutrition are undergoing. The first of which is the Menu Enhancement and Nutrition Module, also called the Menu Module. This is relating back to the nutrient analysis and menu planning software system that TDA purchased back in August, and we are well into the development of the system, though we basically bought it off the shelf. We did add a few bells and whistles to it, and so we are continuing to develop those bells and whistles for you, such as a way to indicate local products used in your menus, as well, and a phone application for the system. The system is, in general, just what the name says. It is a system that analyzes menus, allows the user to plan menus, and then it'll spit out reports such as food production records, nutrient analysis reports, food cost reports. It also supplies menu worksheets, which are utilized to ensure that the menus you have served daily and weekly meet the federal requirements. Some other options it's going to offer is it's going to allow for automated Spanish translation for any user that might need that functionality. And then the mobile application will actually be an environment that parents and students can use to view the menu served at their child's school. It allows them to kind of make choices of what they might eat in a certain day, and it'll calculate the nutrient content of their choices. It also allows for parents and or students to provide feedback to the child nutrition department on the things that they liked and disliked on the menu. So as of February, we have the actual software package in hand, and we are just adding a few things onto that. Come August of this year, we are going to be piloting this specific software with some of the contracting entities in the state. We are focusing in the San Antonio area for the pilot, and we have 5 schools that have elected to participate. And then the Region 20 Education Service Center in that area is going to help us to help those schools and provide training and technical assistance. This coming April, we are doing lots of training for both the education service centers and for the pilot contracting entities to help get them up to speed on the functionality of the system and how it works, again, to prepare for a rollout of the pilot come August of 2016. The pilot will run through December, and then after that, we will sort of gather what information we have learned from the pilot before we release it a year from now statewide, if everything stays on track. These are sort of soft dates. Another new addition to the Texas Department of Agriculture is a community engagement specialist. Her name is Michelle Esper Martin, and contracting entities across the state will start seeing her at various conferences and functions. And the purpose of this position was to provide outreach, networking, assistance, partnering, and success with the actual communities that surround school food authorities. And so under the outreaching, they're going to be looking to promote healthy living initiatives, increase participation in the National School Lunch and School Breakfast programs, as well as the Summer Food Service program. And then just provide a better understanding of our programs, what they require, what they offer, what is available to the community through our programs. With the networking, just again trying to create a healthy community network where the community as a whole comes together to try and make healthy changes to overall benefit the community. Trying to develop a farm fresh network where we can introduce the farmers to the communities and they can start learning where their food comes from, and then working with other local organizations that are in that community. And in the end, we hope to assist in the development and delivery of resources, build community capacity, and create long-term initiative success. And we are measuring success as showcasing healthy role models and inspiring Texans to choose healthy lifestyles and build stronger communities. The partnering is to identify and mobilize the communities, and I'm going to talk a little bit in the next slide about the AmeriCorps Vista program with which we are partnering with for these initiatives. We want to connect with the elected officials in those communities, the school administrators, the parents, and any other champions or like-minded community leaders. And then, again, leveraging this Vista program to partner with these local organizations to help make healthy changes. So the Vista program, again, it's the AmeriCorps Vista Volunteer Program, and TDA has entered into a contractual agreement to work with them. We're going to actually hire Vista, well, not hire, but obtain Vista volunteers that will live and actively participate in the rural Texas communities for 1 year, ensure that low-income youth receive the benefits of good school wellness policies, conduct community outreach and encourage engagement, and they're going to do this through speaking at public forums to inform and educate and engage local citizens, and then help community leaders revise their local wellness policies, develop strategies to expand meal services to children in need, and again, trying to make a connection between the local farmers to schools for direct sourcing of nutritious ingredients. So it's kind of the overall objectives and goals of this partnership with the Vista program. And so we are looking forward to getting that rolling out this June. And there'll be some time period where we're going to be working with the Vistas to train them on our programs and prepare them probably to go ready to go out and work in the communities at the beginning of the school year. So that is the update from TDA. And Michelle, I'm going to turn this back over to you.
Thanks, Jackie. I'm talking, and of course, I'm not unmuted. Could you share the name of your community engagement specialist again?
Her name is Michelle Esper Martin.
Perfect. Okay. Okay. So next up, let me unmute Barney. Let's see, did you change it to me? Not showing, screen sharing. Okay, hold on. Did anybody else have questions for Jackie? Please enter them into the question box. And in the meantime, Barney, what do you have to share with us today?
Good morning, ladies and gentlemen. Hope all is well with everyone on this wonderful Wednesday morning. I was on the agenda to discuss Fitnessgram with everyone. However, I still don't have any new information to share regarding Fitnessgram, other than information is going to be coming out very soon on the school health listserv, and also in the form of a to the administrator address letter with next steps, guidelines, where to go to opt in to take advantage of the free software again for the next 2 years. So all that information will be coming out very, very soon. I can't give a specific date or time or deadline on that, other than we're really close and it's going to be soon before that information comes out. And I do wish I had more to share, and I apologize for how long the process had to take.
Well, I understand, Barney. Sometimes things move slowly. I'm going to have to pause showing my screen for just a moment. It's not allowing me to enter and open the question box right now. I know one of the questions that I had in there was, when would Fitnessgram be released? So we don't know that yet, obviously. So there we have the answer.
Soon.
Okay. I'm not sure why it's not allowing me to get to the questions, guys. We just seem to have all kinds of issues for this month with the technology. Let's see. So I'm going to go back to showing my screen, and Anita Wheeler was supposed to be with us this morning, but I have learned that she has the flu and has been sick for several days. So we will not have an update from DSHS at this time. If she has some information she planned to share, what I will do is send that information out with a follow-up to everyone who signed up for the webinar this morning. Now, I have some brief updates that I would like to go through. Action for Healthy Kids has been working with USDA, and then in Texas working with the Department of Agriculture and also TASB. We have been doing wellness policy webinars over the past year, and we did one yesterday in San Antonio for about 60 school nutrition people, and it was I think it went well. There's a lot of new information, a lot of new resources that we hope we'll be able to share to help schools and school districts as they're working with their school health advisory councils to develop wellness policies. One of the first things we do as part of the workshop is talk about making the case for healthy schools, how important it is to have everybody understand how critical it is for our kids to be healthy, for them to be successful, and the impact that nutrition and physical activity have on their ability to be successful academically. So that's part of the information that we share, because obviously healthy kids learn better and they do better in school. Their behavior issues are less of an obstruction to their ability to be successful. And one of the tools that Action for Healthy Kids has developed is is a document called the Learning Connection, which can be downloaded from the website. It basically makes the case for why breakfast is important, the impact on physical activity on the brain, nutrition, and how much better children do when they have a healthy diet. So that is available on the Action for Healthy Kids website that you'll be able to download. One of the other tools that Action for Healthy Kids has developed with the CDC is a modified version of the School Health Index. The School Health Index is based on the 8 components of coordinated school health, and it can help your school or your school district assess where you may have gaps in your wellness programs. It's available at no cost. You go online to the school health portal, and once you fill out the school health index, it will actually give you an action plan that to help you make steps to improve the wellness policies or take actions to improve the school health environment. It also will allow you to go ahead and apply for any Action for Healthy Kids grants that are open. And we just opened the portal for grants, I believe on the 8th of February. We will have grants this year for breakfast again. So if you're interested in expanding your breakfast program and trying grab and go or trying breakfast in the classroom, we have grants to support that. We will also have some physical activity grants this year, which we haven't had in several years. So you can look on the grant page at the Action for Healthy Kids website. I'll also send some follow-up information on that, so you can check out those as well. This slide just kind of shows what you can do with the School Health Index as far as how you can, once you fill it out, it gives you charts and graphs to show where you have gaps and where you need to work on improving things. And then it will give you an action plan, as I mentioned. There will be a wellness policy, wellness plan webinar on Wednesday, March 23rd. This will review the documents that TASB has developed. TASB has put together a sample wellness policy document as well as a one that you can use to help you get started. And then Texas Department of Agriculture has developed a checklist that you can use that'll help you gather information and see what you need before you sit down to write your wellness policies. We will send you the link to these documents for the checklist as well as the wellness policy and wellness plan from TASB. And then we'll also send the information for the webinar on wellness policies, which will be, as I mentioned, in March. Now, let's see, that was the other document. They're not very easy to see on a slide. So, like I said, we'll send this as well, the checklist. So I think that is going to be all we have this morning. I am not sure. I see that there are some questions, but I am not able to access them for some reason. I'm going to change presenters and see if then it will allow me to do that. Jackie, I'm going to put it back to you. Just don't show your screen. And then we'll be okay. And then we'll see if it will let me look at questions. Nope, it's just not allowing questions this morning. Okay, well, it's going to be a very short webinar today. We will follow up. We have several School Health Advisory Council webinars set for the coming months. You can find those on the Texas team page at actionforhealthykids.org. So there is going to be a lot of good information available. And like I said, we will follow up with the information from our state agencies. I believe we will have another Partnering for School Health webinar coming up in April, and we'll get information out to you in the near future on that. We appreciate you coming, and again, I apologize for the technical difficulties and the shortness of this webinar. It's been a wild start to the first part of the year, but there's a lot of exciting things going on, and we will have more information for you in the coming months. So have a great rest of the week and enjoy the time, and we're going to give back to you this morning.